Displaced Abomasum by Karen Cruz. You may be asking, what is displaced abomasum? Displaced abomasum is a digestive problem that is commonly found in dairy cows. Cows have 4 stomachs, and the abomasum is the last one and where most of the digestion happens. The abomasum can move from where it is supposed to sit in the lower right side of the abdomen to either more to the left or more to the right. If it goes left, it is called left displaced abomasum, and if it goes right, it is called right displaced abomasum. If this stomach gets displaced, it needs to be treated immediately. It will mess up the digestion of the cow and can lead to major issues such as death. The main causes we see are due to stress, dietary imbalance, and metabolic shifts that occur during calving. There are a few different ways to prevent this. The first one is by reducing stress during calving. This can be done by keeping a consistent feeding schedule and provide a low-stress environment before and after birth. Another way to prevent displaced abomasum is to keep the cattle on a healthy diet. Feeding them a balanced diet with a good amount of fiber is what is recommended. Fiber will allow the abomasum to move normally and stop gas buildup that could push it out of place. You do face issues if you keep them on a high grain and low fiber diet because it will slow the abomasum movement down. Lastly, if you are going to change their diet, make the transition slowly. Slowing the adjustment of their diet during calving will allow them to keep a healthy digestion and avoid hypoproteinemia. Signs and symptoms to watch for are loss of appetite, loss of milk production, and abdominal discomfort. You also hear a pinging sound when you're listening to the abdomen. Testing for this condition is pretty simple. An ultrasound will show the position of the abomasum. This will allow for diagnosis without doing any type of surgery. The next one would be a laparoscopy, which allows the veterinarian to look right into the abomasum. This is not very invasive, but it will show exactly what is wrong. Both of these will show if the abomasum is displaced directly. An abdominocentesis is when the veterinarian will take a fluid sample from the abdominal cavity with a needle. If there is perineurosis, which is inflammation of the abdomen lining, the fluid will show high protein levels and a high white blood cell count. Treatment for this condition is pretty simple. It will require surgery, or abdomospexy is what it's called. This is when they secure the abomasum to the abdominal wall or a nearby structure to hold it in its correct place. The goal is to keep it from moving again. Medications will be given to assist the condition. Antibiotics will reduce the risk of infection or peritonitis. A pain relief or anti-allergistic will be given to help the cow be more comfortable, but it is important that the medication isn't hypotoxic. That will cause damage to the liver. An anti-inflammatory will also be given to reduce swelling and pain. All medications will be given intramuscularly or intravenously. After surgery, rehydrating and balancing the cow's electrolytes are extremely important. This will also be done orally or invasively. During recovery, it is important to keep a close eye on the cow to ensure that they don't have any more digestive issues or hematochezis. A main one to watch for is ileus. That is when the gut stops moving food altogether. Their diet should be rich in fiber and introduced slowly. Managing this condition requires you to pay close attention to stress management, quick intervention, and diet planning. Through fast diagnosis and treatment, farmers can make sure that their cattle remain productive and healthy. Thank you all so much for listening.